Let's talk about anemia today. Why? Because it impacts a large number of women in the reproductive age group. So, say the age group of 15 to 50. And secondly, because I feel it can be dealt fairly well through naturopathy. Simply defined, anemia falls in the category of blood disorders. There are more complicated forms of anemia like thalassemia or like pernicious anemia. In this video, we are not going to go into those. We're going to talk about the simple anemia, which is low red blood cells or a lack of hemoglobin in one's body. Now, what does that mean, right? How does one feel anemia in the body, or how does one recognize the symptoms of anemia in one's body? Well, the most common one is breathlessness, and especially breathlessness after one has done a fair amount of physical exertion or exercise. This could include like walking up and down stairs or doing a lot of housework, and one can start feeling as if one is pulling one's breath. The other symptom is constant fatigue or weakness. It is not uncommon for people who have chronic anemia or acute anemia to always want to lie down because they're always feeling as if I am feeling too weak. Uh, Thirdly, and this is sometimes the most significant, is how it impacts our hunger and appetite. Now, there is a vicious cycle here between anemia and anorexia. Uh, we don't know what causes what. Sometimes it can be that someone has been anorexic and has now reached a stage where their digestion just doesn't work, or there is just no sense of hunger in the body. Sometimes it is because one was so anemic that the digestion had slowed down so much that they have now become anorexic. So this is the other symptom which can be very significant in people who have anemia. The fourth one is, of course, what is called pallor, or a certain paleness in the skin. One can notice it, in their skin color, which can start looking a little yellowish almost, or one can notice it in what is called the mucous membranes of the body. So if you open one's mouth and you look at the upper palate, it can start feeling a little pale. Uh, the other signs of anemia are drowsiness, a lot of laziness. It is also sometimes called a general malaise, or a slightly low mood. Um, and then there is the loss of immunity. Now, when one is living with chronic anemia, it is not uncommon for these people to also get a lot of infections, or a lot of allergies in the body. And this also happens because the blood is also the carrier of the white blood cells. So if you have low blood in your body, it is but natural that your white blood cells are also not reaching all the parts of the body where it needs to fight an infection, and hence you can constantly be ridden with allergies and infections. Uh, there is another symptom which is not very commonly understood, and that is about the relation between anemia and fat. Uh, Body tissue which has been deprived of oxygen often becomes fatty tissue, and hence sometimes people who are actually anemic can also appear very fat on the outside, or they can have fatty deposits all over their body, which starts getting visible. So all these signs and all these symptoms ultimately lead someone to have what would I would call suboptimal health, or not a good standard or quality of health. Let's talk about the reasons why someone can become anemic, and we're going to try and focus on three big reasons. The first one is that you're bleeding out, or that for some reason your body has excessive bleeding. So there is no problem in the blood getting formed in your body, but you are anemic just because you are losing more blood than your body is actually producing. Uh, where can this happen? This can happen if you have certain conditions like ulcers or piles, which is constantly making your body bleed out. It can happen if you've had an injury and hence there is blood loss. Or again, in the case of women, it can happen when you, as a regular feature of your reproductive cycle, have excessive bleeding or heavy bleeding, or you are a woman who is approaching her menopausal age and is slightly bleeding out more than normal. Now, let's talk about the more excessive bleeding which women go through. And this is where, again, it becomes a little bit of a chicken and a egg situation. The reason you're anemic is because you're losing too much blood in your monthly cycle. One of the reasons you could be losing more blood in your monthly cycle is because you're anemic. Now, what does this logically mean? Uh, See, just try and understand that when we say blood, it actually is partly solid matter, which is where the cells are, the red blood cells and the white blood cells, and partly liquid, which is where our plasma and more fluid is. When someone gets anemic and they have lesser red blood cells, then actually the solid part of the blood is getting diminished, which means that the blood by nature in anemia is getting thinner and thinner, and thinner blood bleeds out more. And this is what can happen in your monthly cycles, right? If you are anemic, the reason you could be bleeding out more is also because your blood is a little more thinner than what it should be. So what can you do about it? Well, from a food perspective and naturopathy perspective, the one thing you don't want to be doing is having food items that also make blood thinner. The big ticket items here are actually flax seeds, garlic, cumin, and lot of lemon. So these four items, if for any reason you are having in their raw form in excess, then please don't have it if you are bleeding out a lot more in your monthly cycles. What is the other thing you can do to stop the monthly bleeding if it is excessive? Well, I have a video which we recently made on perimenopause, and I would request that you also go watch that, where we have talked significantly about how to tackle that. I'll put a link of that in the notes to this video. The second big reason why one can develop anemia in one's body is actually where the gut gets involved. Now, when I'm talking about the gut, I'm actually talking about four big organs in the body. One is your esophagus, the second is your stomach, the third is your small intestine, and the fourth is your large intestine, or what we generally end up calling the colon. If you suffer from constipation or piles or any condition of the gut where you do not clear your gut every 24 hours, then there is a very large likelihood that you are reabsorbing some of the toxic matter into your bloodstream. And a toxic bloodstream is bound to destroy your red blood cells, especially the ones which are younger and getting more newly formed. And this could be one reason why you would develop anemia. The organ actually that we are most interested in when we are treating anemia is the stomach. Now, and why this is significant is because the absorption of iron actually happens in a place in the stomach. It actually happens where the stomach just meets the small intestine, and for that reason, one of the reasons one can develop anemia is because the absorption is not adequate. So if we have a bad stomach, and what do I mean by when I say that we have a bad stomach, is that the stomach for some reason is not doing its digestive function properly, then there is a large likelihood that anemia can develop. Again, how do you notice it for yourself in your body? The big markers here are your hunger. So if you have very little hunger or very little appetite, then that's a sign that the stomach is not functioning to its optimal. The second is, of course, what happens to you immediately after you eat food. If you feel very heavy, if you feel immediately bloated, or if you feel immediately tired and want to lie down after eating a meal, then again there is an issue with your stomach. Headaches when your stomach is empty, or again after consuming food, is another sign that your stomach is not okay. Now, in anemia, like I said, the organ of interest is the stomach, and one does need to clean the stomach before one can resolve anemia. Uh, to do this, well, ideally, one would need to work with someone, because it is not so straightforward as to how one resolves the stomach issue. But however, if you want to try a few things on your own, then there is an article which I have written before on the gut and the stomach, and I will again attach it to the notes of this video, and you can read that in your own time. The one thing you want to be careful of, if you discover that you have a stomach issue and you do have ongoing chronic anemia, is your intake of tea. Now, surprisingly, this is the only condition where I'm going to say that coffee is actually better than tea. And there is a very logical reason for that. Tea directly impacts the stomach lining and makes it extremely acidic. Coffee, while it has a lot of other side effects, does not impact the stomach lining so much. It has more impact on your nervous system and kidneys, but uh, well, luckily in this case, not on your stomach. So, if you are someone with a habit of drinking a lot of tea, then substituting tea with coffee might actually work for you. The other thing that might work for you is to not have tea empty stomach, because that is where it gets the most deadly when the stomach is involved. So if we can't give up the tea habit, and I am one of those people, then the thing we can at least do is to make sure we never have it empty stomach, and then also to make sure we never have it very black or very potent. So make it a little milky, and have it after you have eaten stuff. Okay. The third big reason why someone will get anemia is, of course, the nutritional part of it, or the nutritional deficiencies. The big things that we are concerned about here is your nutrition around iron, your B vitamins, and also calcium. Calcium has a strange relationship with iron, which again is not very well understood. And the reason for that is that actually iron and calcium are absorbed from the same site in the stomach and small intestine. Um, that And hence they go hand in hand. So it is not uncommon for people who have chronic anemia to also develop calcium deficiency in the long run. So if your anemia is because you're nutritionally deficient, then that is something we can tackle more. Let's understand how we can use food as medicine to deal with anemia. Now, remember in the beginning of this video, I mentioned that one of the symptoms of anemia is that there tends to be indigestion or low digestion, and a general sense of weakness in the body. So, what we don't want to do is put very dense foods, right? So, there is always the talk of using millets like ragi and sometimes even bajra to treat anemia. But if you're already someone who has a weak digestion and a suboptimal stomach, then nutritionally dense food is not what you want to start with. What you want to start with are actually the juices, which will help you significantly deal with making blood. And the citrus fruits here have a very big role to play. So, sweet lime, what we call masammi in Hindi, is your biggest ticket item here. What you want to do is at least have 300 ml of that juice empty stomach. Please don't add anything to that juice. So about 4 5 6 masamis, depending upon the size of the masami of the sweet lime. Just juice it and just have it. If you notice that you also have more calcium deficiency along with a blood deficiency, then oranges will work better for you. And again, it's the same quantity. So have at least 300 ml of that empty stomach, preferably first thing in the morning. Uh, if you are someone who has more of the B vitamin deficiencies, and especially B12 is coming up for you, then what you want to also include is pomegranate juice. Now, again, anar juice or pomegranate juice needs to be had empty stomach. The quantity here can be about 200 ml, um, and just consume it as it is. The other juices which really help with anemia are two vegetables. One is beetroot and one is carrot. The way to have beetroot juice is to again have 300 ml minimum in quantity. So about 2 to 3 beetroots, or what we call chukandar in Hindi, depending on the size of it, one cucumber or kheera, and this is where you also add some gooseberry or amla to it. Now just remember the actual ABC juice is not apple, beetroot, carrot, but amla, beetroot, carrot, and it is exactly to be had in this ratio. So 2 to 3 amla, 2 to 3 beetroot, and about 6 to 7 carrots is how you bring it all together and make sure that you get at least 300 ml of juice and you consume it. uh, like I said, if for some reason you're not using carrot here, you can also use cucumber here. It will still remain as your ABC juice. If we are not in the winter season in India and amla or gooseberry is a problem, then this is the only time we add a little bit of lime to the juice. Again, just remember I spoke about not using too much excess of lime and lemon when you have anemia. So once you've taken out the juice, just add like just half a lemon or a little bit of lime to this juice and consume it. One can also add spinach to carrot and have that juice. The only people who should not do it is if you already have a slightly loose stomach or a tendency towards IBS, then don't use raw spinach. Otherwise, what you can do is use carrot as the base of the juice. So 6-7 carrots, enough to give you 300 ml of juice, and a handful, or what I would call a palm full of raw spinach washed properly, can be added to that juice and had, right? The other food items which are not in juice form but actually in whole food form that work best for anemia is actually consuming a lot of apples or a lot of grapes when they are in season. Now the way you want to do this is make sure that you at least have one meal of this fruit and you have it only as a mono fruit. So my recommendation always is that if you're going to do this as a one meal thing, then choose a time between 8 a.m. to say 12 and just consume that one variety of fruit. So apple in apple season and grapes in grape season, right? And you just keep having that from 8 to 12, and then you are done with it, and then you can shift an hour later to your cooked food. Do not mix the fruit with the cooked food in under any circumstances. The other food items that help a lot with anemia and can be had more in snack form is actually raw coconut, dates, and if you are slightly diabetics, then instead of dates, please use chwara or what is called the raw date. The way you want to consume it is actually as a snack, so you can have it anytime during the day, especially if you feel you're getting more allergies and a lot of infections, then I highly recommend using raw coconut off and on in your food and as part of your diet. Now all this will help you with anemia, but just remember that the red blood cells have a cycle of 120 days. That is, it takes 3 months for new red blood cells to get formed. So when you want to try these things, you want to do it for a period of at least 3 months, and then see if you have seen a significant change or not.